Hello, my name is Hayley Peake. I'm the Senior Health and Social Care Business Partner for Serco, and today I'm presenting the Modernising Medication Management in a Prison Setting project on behalf of Serco, Tracker, Practice Plus Group and Unilink. So what is it? What is the concept that we built and designed? Well, as you can see from this slide, we designed, built and piloted a medication locker solution to allow prisoners to collect in possession medications remotely without a clinician being present. So in prisons, prisoners can either have their medication not in possession, so this is supervised, such as controlled drugs or those drugs that can be traded, or in possession, which are lower risk medications, and prisoners can have them within their cell. Prior to this project, medications had to be collected from the same locations from clinicians with restricted access, and this impacted clinicians and prisoners alike. So this is the locker system, and what happens here is the clinicians load the medication. This sends an alert to the prisoners to say the medications are ready, and when the prisoners attend for their medications, they biometric onto the reader on the right, and it opens up the randomly selected locker where their medications will be based. What does this mean? So in terms of collecting their medications, it means it provides a flexibility for residents with their medication, and it lets them know when it's ready to collect. It enhances patient safety, so ensuring the correct person is collecting their medications via biometrics, so very accurate. It produces an audit trail for when staff members have loaded the lockers and who has loaded those lockers, but also separates out the in possession and non-in possession medication queues. It provides an audit trail for what and when the prisoners collected, and also allows us to monitor DNAs and enables clinical staff to concentrate on clinical tasks. It also provides a list for the prison staff to know who is on medication and who that they need to make sure gets to that locker within the day, and provides scope within the regime. So what were the issues and why did we do this? As you can see here, HMP Dovegate is a Category B male prison with 1,160 male residents. It's operated by Serco on behalf of the MOJ, and Practice Plus Group is the healthcare provider. For this project, both Tracker and Unilink designed and built the concept for which we piloted. And why did we do this? For the prisoner population. So as you can see here, the statement at the top, the health, economic and social inequalities faced by the population in contact with the criminal justice system is stark and striking. And I think that this is really encapsulated by these figures, but here you can see that the mortality rate for prisoners is 50% higher than the rest of the population, and that there's a higher prevalence of physical conditions, long-term conditions, substance misuse and mental health amongst this population. And this is exacerbated by the fact that it's a complex system with multiple partners and also delivering services which can often lead to gaps in the provision. For medications in prisons is that we know we're seeing more medications within prisons, and this was projected to rise. This is because of the increased prisoner population, the unprecedented ageing population, but also those conditions that I mentioned earlier. That combined with the illicit economy, so the trading of drugs and prescribed medications for those with substance misuse issues, was increasing alongside the national increases in prescribed medications. There's been some changes in the legislation which meant there was more controlled or supervised medications, and just from the finite footprint that you saw earlier of the prison, there's space restrictions which meant it's difficult to expand the service any wider. So in terms of solutions, when we looked at this, we'd already tried and tested a number of operational solutions which weren't successful and weren't going to give us the benefits that we required to improve the patient's outcomes. So we knew that it would be a technological solution, and that's what we took forward after reviewing that was in the market. There wasn't a clear solution that was already in the market. That's why we worked with our partners, Tracker and Unilink, to develop this solution. And just looking at those issues a bit more deeply for the prisoners and also our providers, there's delays in the regimes, which mean they're constantly waiting and missing out on aspects within the prison which can help them reduce their reoffending potential. Flashpoint of violence because of the frustration of waiting in the queue, potentially bullying, but also that reduced control and dependence. For our staff, both clinical and custodial, the frustration around delays in regimes for the ongoing medications, the safety implications of the violence, but also a rise in complaints. So the most complaints in the majority of our areas were around medication management. and that meant that we weren't able to provide equivalents to that within the community. And the infrastructure, whilst also frustrating, was a poor working condition for our clinicians when delivering medications. So many problems were identified. But with any problem, there's a solution and a number of stakeholders we had to engage. So any technological solution within a prison is difficult, and as such, there were a number of people we engaged. So we've got the primary stakeholders here, so particularly our healthcare provider, PPG, and their oversight and governance from a pharmacy point of view, but also the head of healthcare and the clinical team really engaged with this project. Our other healthcare providers across a number of prisons as well consulted around the solution we were developing from Tracker and Unilink. Serco provided oversight and support from a residential point of view, but also facilities management, security and governance, particularly around information security, and also our commissioners and regulatory bodies were providing support and guidance where required. We had some clearly defined aims and objectives, which was to determine the site, build the solution, deliver the solution, and monitor that to learn lessons and share with across the estate. So that required a quite robust review and consultation metrics, which is set out here. We had pre and post implementation questionnaires and focus groups, and that was with clinical, custodial and patients as well that engaged in those. And that was reviewed and also made changes within our weekly project review meetings. And what did this tell us? So we had a hypothesis, and our pre-implementation questionnaire really confirmed that the issues with prisoners were that they weren't experiencing a satisfactory process around medications management. That was what was believed, and the initial questionnaire showed us that. The length of time they were waiting and how that impacted on them. And actually, in terms of the post-implementation work, we saw that 80% of those that had used the lockers found that they were positive, and 92% of the population were also positive about their experience, with only 8% not being satisfied. And in the prison population, this is a really positive rate. The only improvements that the individuals would like to see were around processes outside of the scope of the project as well, so automated reordering and repeat prescription processes, which we've taken forward into the project group. In terms of the feedback, it was overwhelmingly positive from our patients. So improved awareness, compliance, it was less disruption, more automated, improved consistency, and really increased ownership as well as privacy. And some of the statements we've got back from prisoners are pretty compelling. And I think my favourite one here is the best thing I've seen in a prison, and I've been in a lot of prisons, and it was overwhelmingly positive. The same from our clinical team, so increased management and independence for our prisoners, and the outcomes were the key thing that our clinical staff were really positive about, but also the bit around decreasing errors and improving accuracy for this important task, and the fact that it was a better working experience for the clinical members of staff that had used this. The feedback was the same from our custodial staff as well, around the fact that it saved time, improved the patient's outcomes, reduces the stresses of the overlap between the clinical and custodial team around that tension of delivery, and some really positive comments were mentioned from our custodial team. So in terms of the lessons that we've learned from this project, and there have been many, patient and staff feedback has been crucial, as well as the engagement with our key stakeholders that I mentioned earlier. And that's largely around the changes and the software changes that we've implemented. So the biometric reader were improved. We've improved the access time around prisoners, how they access the lockers. The touchscreen panel has been covered to avoid confusion, and an alarm was added to ensure that prisoners were shutting the door effectively. But we've also made changes to the clinical setup and the audit-based system, which are massively improved, as well as moving from a manual process from unlocking the lockers and to make that automated with a burst all doors function, which has really improved the load times for the clinical team. Our engagement has meant that we was able to identify and mitigate risks early and to build that into the development plans, but also that our stakeholders were aware of what we was doing and were with us every step of the way. Our partnership working has also been crucial, but has been fantastic throughout this project. It's really tricky, and actually we've overcome the barriers, tracked the benefits and understood the requirements that we're trying to deliver. And finally, what we learned was to continually improve. We started with a clear outcome, but actually it's developed much more outside the scope of that. And the team have changed their skill match to support a much more improved medications pathway, we've improved processes, natural functionality, so continually adapt and improving this for the benefit of our cohort. And what's next? So we've rolled out now into Dovegate Main Prison and a number of other Serco sites, and Practice Plus Group are rolling out this concept nationally. We are also confirming the wider rollout potential for other sites outside the scope of Practice Plus Group and also Serco. We have submitted our findings, and these are awaiting publication at the moment. And we've also agreed some implementation principles to support other providers to roll this out more widely. Thank you very much. Now over to questions.